Hi there, I am Liz Voiles. Welcome to our webinar on earned sick leave. I am the Vice President of Communications at CityHealth. We are very excited to have you all here today, joining us from all over the country. We're excited to take your questions. We have a wonderful lineup of experts here to speak to you today about their expertise, their experiences with this policy. We're going to be going over some findings from a brand new opinion poll that was fielded only a couple weeks ago of the American public about earned sick leave that we're really excited to talk about. And I just am gonna go over sort of who's on the phone today and then how you can ask your questions as the presenters go through their slides. So we'll be hearing, just up top, I'm gonna name our presenters and then I will introduce them. So we have Katrina Forrest, who is Director of Partnerships at CityHealth. We have Jennifer Herriott, who is here as a practitioner from the health department in San Antonio, Texas. We have Dr. Rex Archer, who is coming to you all today from Kansas City, Missouri. He's head of the health department there. And we have Michael Earls, who is from NP Strategy Group. And he is going to talk to you all today about that new poll on earned sick leave. So just to go through a little bit of housekeeping on how you ask your questions. We are going to answer your questions at the end of the presentation. We hope to have a lively Q&A. We encourage you to engage with our experts. You can ask your question at any time. They're just going to answer it at the end. So the way that you can do that is we're going to be using the chat box as sort of a catch-all for your questions today. So open up that chat box. Just give us your name and your affiliation before you ask your question, and then fire away, and we will answer it at the end. So again, I want to welcome you all, and I will now turn over the mic to my colleague, Katrina Forrest, the National Director of Partnerships for CityHealth.
Great, thanks Liz, and thanks again to everyone for joining us today. Earned sick leave has become absolutely essential to safeguarding health and the economy as cities across the country are working through their COVID-19 response and recovery efforts. So I am super excited about the group of panelists that we have today and engaging more deeply with all of you, both through this webinar and hopefully beyond. Before I dive in, I do want to give a quick overview about CityHealth, who we are, and our process. So CityHealth aims to help cities thrive through the adoption of policies that improve people's day-to-day lives. We have curated a package of 9 evidence-based policies, and on an annual basis, we assess cities based on the number and strength of those policies that they have adopted. Additionally, we support cities that are seeking to take action on implementing these policies through the provision of technical assistance, as well as providing access to model ordinance language. Next slide, please. Great. So as it relates to earned sick leave, CityHealth believes that every worker and every community absolutely deserves access to this vitally important benefit. In the wake of COVID-19, earned sick leave has gained national traction, and we certainly applaud the federal government as well as a number of cities and states that have moved to adopt this on a temporary basis. But fighting contagious illness and supporting income and employment stability should not be time-limited outcomes. So whether it's COVID-19, whether it's hepatitis A or the seasonal flu, we know that other infectious disease outbreaks happen and they can wreak havoc. And it's for this reason that we believe cities should move forward with adopting durable, permanent policies that we know ensure individuals and communities will be protected from the spread of contagious diseases and businesses will be helped by reducing workplace illness and increasing overall productivity. So with that, you should see on the screen our scoring matrix. And I want to walk through this with you so you get a sense of what we consider a gold standard. And I should say at the outset, across all of our policies, our METAL criteria is developed in partnership and consultation with a number of subject matter experts, as well as local leaders across a wide variety of sectors and across a bunch of different regions. So as you can see, to earn a bronze medal from CityHealth, a city simply has to adopt an earn sick policy. There we are talking about comprehensive policies that are applicable to all private employers. To earn a silver medal, you have to have the policy, and the policy must allow employees to both take care of a family member as well as use the leave for domestic violence recovery. That last piece, both of these are very critical, but that last piece is of significant import in this moment, because one of the things that we were seeing sort of at the height of shelter at home was an uptick in the number of domestic violence incidences. And so we believe including these provisions is extremely important. Additionally, to earn a silver medal, the policy must explicitly state that the minimum amount of leave an employee can earn is 40 hours, which is equivalent to 5 days. For a gold medal, all of the things that I've just discussed for silver have to be in place with 2 critical distinctions. And one is that the minimum amount of time an employee's leave that they can accrue has to be greater than or equal to 48 hours, which is 6 days. And the policy must apply to businesses as small as 1 employee. We can go to the next slide. So here you can see a bit of our medal distribution. As I said at the outset, CityHealth assesses cities, and currently we are assessing the largest 40 US cities. And to date, 23 out of our 40 cities have earned a medal. As you'll see, 5 gold, 6 silver, and 12 bronze. Next slide. Here you can see the full distribution as well as the number of cities that do not currently have a policy in place. And so from this, what we see is that there's still a long ways to go, but we think this presents enormous opportunities for cities to take action. And I just want to let all of you know that CityHealth is absolutely here as a resource. So if there's anyone on this webinar that is interested in pursuing a strong, durable, earned sick leave policy, I would love to hear from you. As I said before, we provide technical assistance, we offer access to model ordinance language, and we are really here as a resource to you. And so please, please, please reach out. And with that, I do look forward to answering your questions at the end, and I will turn it back over to Liz to introduce our next speaker.
Great, thank you so much, Katrina. We are now going to hear from Jennifer Herriott, who is Assistant Director of the San Antonio Metropolitan Health District.
Hello, everyone. Thank you for having me here. I have the opportunity to work on this ordinance with our current Assistant City Manager, Colleen Bridger, who was initially invited to participate, and she's tied up with some COVID things, and so she asked me to step in. So thank you for the opportunity to do that. We can go ahead and go to the next slide, please. So San Antonio has an estimated 354,000 workers who don't get paid sick leave benefits at this time. Our population is estimated about 1.5 million. So I just wanted to kind of set that as a backdrop. The San Antonio ordinance does provide for all of those items that Katrina just listed. Employees can earn up to 56 hours of paid time off from work because their family is sick, injured, or has experienced domestic violence, sexual assault, or stalking. And it can also be used, importantly, for preventive care, mental health care, or to seek relocation for victim services. Next slide, please. Next slide. There we go, thank you. The ordinance was brought to the city council via a petition, which was signed by 144,000 individuals, which is really double the minimum requirement. And this petition was led by a group of grassroots organizations throughout San Antonio. When the petition was brought to city council and was ratified, that there were two opportunities at that point. The city council could either place the ordinance on the ballot for a vote, or they could adopt it as it was. And they chose to go ahead and adopt the ordinance as it was drafted and submitted by all of those petitioners. Next slide, please. Next slide. So one of the things that our mayor did was he formed a paid sick leave commission. This commission was developed, actually you can go back one slide, sorry, I'm bouncing around a little bit, but if you can go back to slide 5. He developed a paid sick leave commission, and this commission was made up of members of the community. I think this is something that was really key to San Antonio and key to some of our success. When the paid sick leave ordinance was adopted, we realized that it wasn't exactly where we wanted it to be. And we had the business community and quite frankly, some of our community members that said, hey, we really didn't have an opportunity to provide input. And so city council decided to postpone the implementation of the ordinance so that they could gather input from community members and from the business community. And they felt that that would result in a more favorable outcome in terms of being able to implement the ordinance. So one of the things that the mayor did was he identified a group of people to join this paid sick leave commission. And as I mentioned, it was made up of business owners as well as community members and grassroots organizations. And the goal of that commission was to essentially come to a consensus around recommendations of any of the items that they wanted to change within the ordinance, given the way the ordinance was initially presented. That commission was made up of a number of subcommittees, including compliance and governance, definitions, legal considerations, research and best practices, and of course, implementation. So their charge was not to debate if the paid sick leave was a good idea or not, but rather to determine who or what business would be required to implement. So we determined that it would be all businesses, regardless of size. How leave would be accrued. We determined it would be 1 hour for every 30 hours worked. If leave could be carried over, how soon employees could start using accrued leave, who is going to be eligible, would it include temporary, part-time, paid interns, etc. What paid sick leave could be used for, and I talked about what those items were a little while ago. What kind of verification would be needed, and when verification could be requested by the employer, the signage that was required, how they would go about informing employees to make sure that they were aware of the ordinance and their rights, as well as education for employers and employees. Go ahead to the next slide, please. After all of that work was done and the ordinance was passed, a group of local businesses and business associates sued the city of San Antonio to stop implementation, which was due to take place on August 1st, 2019. The parties did reach an agreement to delay the implementation till December 2019 to allow for time to educate businesses and time to prepare for the implementation of the ordinance. Next slide, please. As I mentioned, there were significant revisions that were made to the ordinance that I described above. And I explained the process that was taken, but that again is one of the, I think, key efforts that was done here in San Antonio was to not only engage the grassroots organizations that had put the petition together, but we also engaged small, medium, and large size organizations We engaged organizations that already had paid sick leave ordinance or paid sick leave policies in place so that they could help medium and smaller entities understand how they had implemented it, what some of the challenges were. But we really engaged our business community through all of our chambers to make sure that they could help us educate their peers and their counterparts and explain the benefits behind the implementation of a paid sick leave ordinance. Next slide, please. One of the other important things that we did was we got a lot of community engagement and community feedback. So when we initially thought we were going to implement the ordinance in August of 2019, we had 6 listening sessions throughout the community, and we invited both employees and employers to participate. And that was really to learn what the ordinance was all about and what the rules were and how we were going to make sure that we provided that information to businesses so that they could correctly implement. The other key thing that we did is we provided for a full year in which we weren't going to actually write any citations if they were not implementing according to the ordinance, but rather we would provide education and help them get into compliance. And only after a full year of it being in place would we actually write any citations or have anything that was punitive for them. Again, our goal really was to educate, make sure they were able to be in compliance, and then provide them with assistance to make sure that they were, as well as be able to explain and educate the community about the ordinance and what their rights were around it. Some of the things that we learned through the community feedback sessions was that the concerns, of course, as you can imagine, that the business community had was the burden of implementation. They felt that they might have to lay people off. Abuse by employees was something that was raised quite frequently. And then, of course, the cost of implementation, they were concerned about that. As you can imagine, employees were very much in favor of implementation of paid sick leave as they realized that it would enable many of them to take care of themselves and their family members in difficult times of illness or domestic violence situations. And so we did spend a lot of time gathering information from both of those stakeholders and listening to them so that when we got ready for implementation, we felt like we would be as ready as possible, that both business community and employees were aware of what their rights were, and that this could be a successful ordinance. Next slide, please. So even though we worked incredibly hard at trying to develop an ordinance or a policy that we felt that both the business community and benefited both the business community or addressed their concerns, but also addressed the needs of our community, unfortunately, a group of business coalitions did submit a lawsuit, and a judge sided in favor of the coalition of business groups, granting them a temporary injunction, which was essentially blocking implementation of our paid sick leave initiative. The plaintiffs basically argued that the ordinance was preempted as it was in contradiction with our Texas Minimum Wage Act. And so that preempted cities from implementing a paid sick leave ordinance. At this time, those business groups urged that the court wait until the Texas Supreme Court weighed in on a similar Austin ordinance. So at this time, our paid sick leave ordinance is on hold. We're not able to implement, but we did go through the whole process of hiring staff, training those staff, and we're very much ready to implement last December of 2019 when the temporary injunction went into place. So we're in a holding pattern, but we're extremely proud of the work that we did. And I'm very happy to provide you with any additional information or answer questions about our process and the ordinance. So at this time, I'll turn it over to the next speaker.
Great, thank you so much, Jennifer. So we're now going to hear from Dr. Rex Archer, who is the Health Department Director for Kansas City, Missouri.
Well, good morning or afternoon, depending on where you are around the country. I want to start off with my top book for everybody. If you've not read Dr. Joshua Sharfstein's book, The Public Health Crisis Survival Guide, Leadership and Management in Trying Times. And this book is a great read. It is critical for where we are right now, but where we will be continuing to go. And it has three major sections and points. We have to early on recognize that we've got a crisis that's starting so that we can be successful in managing and communicating it. But before the crisis is over, we have to start pivoting to how to advocate for the long-term policy changes that could prevent these types of crises in the future. And we also need to learn how to awaken a sense of crisis on long-standing problems and generate change. And I throw that out there because that's in a sense what led to the article, next slide, that we published, staff member and I, back in 2018. And the article was entitled Outbreak Protection and the Importance of Paid Sick Leave. If the title could have been longer, we would have included quarantine leave as part of that title, and we did address that down in the article. And this came to bear because we had had some measles outbreaks. And if you can imagine with measles and when you isolate or self-quarantine folks, if they are on the margins and barely making their rent payments, and then they now can't work, and they have no paid sick leave or quarantine leave, now they're getting evicted, and then how do we isolate or quarantine them? And so we've had interesting conversations around this in the city for quite a while. Unfortunately, and I'll get to that a little bit later, we are preempted by the state, and so even though I'm pretty sure we could get an ordinance passed either by our elected officials or by the overall voters, we would be blocked in the same way that Texas is struggling with right now. This slide, though, shows that over 159 nations do have paid sick leave, and as you can see, many of them have it for not just a month or 2 to 3 months, but even 6 months or more. And the only three there that are more developed industrialized countries are the US, South Korea, and India. And so you can see that we are way behind the curve on this from a policy standpoint. Next slide. So if we think about some updating from when we published this back in 2018, we'll be sharing some of that change. And these changes in policies and this data don't reflect some of the temporary changes that are occurring around the world because of COVID-19. And the duration of the sick leave can vary, and the benefit may be, as mentioned, only for lowest wage earners, et cetera. Benefit duration varies for different kinds of conditions. And as I mentioned, 6 months or more paid leave often includes cases of benefits where it's until recovery or for as long as treatment is required. So that's why it can be even longer than 6 months. Next slide. And this shows across low income, moderate income, and high income. And you'll see there on the far right, the US's dubious distinction of being down there in that red no paid sick leave compared to all these other high income nations. Next slide. And this kind of breaks it out by different continents around the world. And again, you'll see the huge disparity that's developed across the world. Next slide. So how do we get this occurring? And you can hear from the previous example that sometimes the elected officials want to do the right thing, but there's so much pressure from a small group of folks that you can't get it done, and you do then have to go to initiative petitions or other mechanisms to get it to happen. This is a great reference in grassrootspolicy.org on the 4 faces of power, and I just mentioned it because there's the power of organizing around any one individual issue, and we've had our experience with that in Kansas City. But there's the second power, which is the power of political infrastructure building, and that's taking like-minded groups that may not be supporting each other's issues on the surface, but as things come forward to an election, we passed a healthy homes rental inspection program, in part because there was another issue on the ballot in regards to they were trying to block an attempt to undermine unions and to weaken unions in the state. And we were able to bridge to bring several other types of groups where we were all advocating for each other's positions on that ballot issue. There's the power of the narrative, how we actually tell these stories, and we'll be hearing more about what is working well and how the public perceives these issues. Because we're preempted at the state level, we've been playing around with the idea of, well, what if we had an ordinance where every place that doesn't provide paid sick leave had to post up there a warning to the public, attend here or come here at your own risk because we don't value our employees enough to provide paid sick leave. And then the last one there is that power of coercion to maintain the status quo, and that's state preemption or the federal quagmire, because we could overrule the states on this issue with federal guidance on paid sick leave and quarantine leave. Next slide. So I think that moves to the communication strategies on this. Thank you.
And
Thanks
Hale,
so much, Dr. Archer. Oh, I'm just introducing Michael Earls, partner of NP Strategy Group, who is responsible for fielding this fascinating new poll on earned sick leave. Michael, take it away.
thanks, Liz, and thanks to everyone at CityHealth, everyone who's joining today, and the other speakers for having us. So about 15 years ago, I had a chance to work alongside and for some of the folks involved at CityHealth. So it's nice to kind of be back partnering on this. And the firm I'm at, NP Strategy Group, is a public affairs and kind of issue advocacy campaign firm. And our research division does a lot of different types of qualitative and quantitative work. And this includes a monthly omnibus online survey where we ask a number of different questions. So in April, so about a month ago, we partnered with the CityHealth team to come up with a series of questions in regards to paid sick leave, but just underscoring the point during the height of the COVID-19 pandemic. So as a result, the findings you will see are from that April poll. It's a nationwide survey of just over 1,000 respondents. And what I'm going to do is give some of the top levels and takeaways, but we can certainly circulate the full deck with a lot of the granular findings for anyone interested after the fact. So you don't have to try to strain your eyes to follow along on some of the smaller text as we go through. So next slide, please. So you can see a few of the top line takeaways we wanted to kind of start off with in the summaries here. First off, overwhelming support. 78% of the nationwide respondents of just over 1,000 individuals favor a law for guaranteed paid sick leave. And you can see the specific question wording under that first bullet. Overall, do you favor or oppose a law that would guarantee all workers a minimum number of paid sick leaves to care for themselves or immediate family members? Underscoring the point, and you would kind of guess as such with the 78% total support, but there was really broad, overwhelming support for the question across all of the different measured subgroups, and we'll go over those in a minute. And we'll have a specific breakout by party ID, because I think that's one of the more interesting findings from the summary, or from the survey rather. And in addition to that question, we also tested seven different messages in conjunction with the CityHealth folks. And we use, I just wanted to flag, we use the phrasing, you'll see paid sick leave. I know sometimes we've talked about earned sick leave, but specifically we use paid sick leave as the exact term of art. And again, the specific support in asking respondents to gauge how convincing the different messages were, overwhelmingly very, very convincing. There was at least a combined 70% very or somewhat convincing response for each of the 7 questions. So next slide, please. So again, you can see the question wording up at the top. And if you look at the far left, that's the column that has overall support. And a few of the takeaways as you start to scan against some of the subgroups that we break out here, there's very, very overwhelming support. Of note, there's a level of consistency across a lot of the different measured subgroups that you'll notice. While there's slight variations, it's as you see a relatively narrow band. So going through very, very briefly, certainly by gender, very, very close. If you look at the age breakdown, again, anecdotally, slightly higher in the 25 to 34 and 35 to 44. Perhaps we could guess that, those are some of the individuals that are most dealing right now with childcare, as well as potentially aging parents, some of those populations. And then going across type of community one lives in, as well as region of the country, you find that broad support. Looking at the bottom, I also wanted to highlight, in addition to the overall support number, pretty interesting that the opposition is actually lower in most cases, the flat out opposition, than the respondents who are saying either I'm not sure or that didn't feel that they could offer an opinion. So not a lot of opposition to this. We're going to get into the party breakdown in a second, as mentioned. I did want to flag, you're not going to see the specific breakouts by race and ethnicity here. Our firm does a lot of work in particular with the Latino and AAPI communities. We do a lot of granular work. We're doing a project right now that's just among Florida Hispanics. And I think because of a lot of the work we do that's very precisely measuring race and ethnicity groups, we are very attuned to the kind of methodological needs, and the omnibus survey, to be blunt, is not really designed for that. So we didn't want to kind of have to add a lot of caveats about margins and methodology things. So we are not including the racial and ethnic breakouts from this. So happy to have, obviously, if anyone is interested following up, could talk more about that. But I did want to highlight on the next slide, if we're ready to go, some of the remarkable findings on the partisanship. I don't think it's a surprise for anyone listening that we're in incredibly, partisan days. And oftentimes on issues that we test, you'll find our research that when you break out the subgroups by party affiliation, you oftentimes see almost a mirror image, the inverse of, Democratic and Republican responses on a number of questions. And I think while there's a 20 percentage point distinction between the Democratic respondents and the Republican respondents, compared to a number of other issues, I think that that's not as big a delta as we frequently see on some other issues we test. And of note, again, I think broader takeaway again is just the broad support. If you look at that Republican category, very, very strong in terms of the overall support for the question as it was worded. So if you want to go to the next slide, we can start going through a few of the messages, and we can actually blow past that one and go right into the specific messages. As noted at the top, we worked on 7 specific messages that were tested. And for these, we asked the respondent to gauge on a 4-point scale, very, somewhat, not very, very, very convincing, somewhat unconvincing, or not at all convincing. And so the findings finding very high and durable support across each of the questions, for folks finding all of these questions convincing. The breakouts of the 2 top ones, you can see the specific wording. And the strong majority there is folks rating it at the most high, the very convincing. So a combined 86% of respondents thought the question on the left, highlighting the workers in the restaurant, childcare, and healthcare industries, found that argument very convincing. And then the yellow bar there is the additional add-on of the somewhat convincing population. So a combined 86% rated that convincing. And then similarly, the one next to it, in terms of leading with the fact that we are in the middle of the global pandemic, and highlighting how these types of policies can save lives. Very similar, an 82% finding, with again a strong majority in favor of the very convincing bar. So if we can go to the next slide, please. You'll see there, these are the 7 different questions that we tested messaging for. As noted at the top, we probably won't go through all of these right now, but again, we can circulate the full deck so you can go through in more detail. So if you can move to the next slide, we're gonna look for the specific breakouts in a second by the top 2 performing messages. One note before we go on to the message 1 in detail and message 2 in detail, you'll notice that the top 2 performing ones are in kind of review, the 2 that most directly address that we are in a pandemic right now. We did not do, trend lines over time. So, we haven't tested this before COVID-19. But of note, these are the 2 that seem most precisely tied to the current moment and the reality that everyone's facing. So let's move on to the next slide, please. And so this is the first message that we highlighted a few slides back. And you'll see the breakout again by some of the subgroups that we tested. And this is just of those who found it very convincing, so the highest rating. And you'll see again a strong level of uniformity across a lot of the measured subgroups. And again, underscoring the point just raised about the idea that this is something that is very much tied to the current moment, and the fact that the broader public health is tied to these types of individual decisions and forcing people to potentially work when they're sick. And then if we want to go on to the next slide, you'll see again the subgroup breakout for a lot of for a lot of the different categories tested. And again, it's that second highest rated message. And again, this is just the very convincing, so the top rated by subgroups. And again, I think one of the takeaways is just the broad consistency across a lot of the different measured subgroups for this. So let's move on to the last slide. I think just to highlight, if there's any further questions, certainly go through the folks at CityHealth. My information is there. And as I said, we can circulate the full deck after, so you can take more time to review. And if there are questions that pop up, don't hesitate to find a way to reach out. So thank you.
Great. Thank you so much, Michael, and to all of our presenters today. Now is the time when we ask you to bring us your questions and engage with us. So again, you can do that through the chat box. Make sure that if you ask a question, even if it's for a particular presenter, that you address it to all panelists so that I can read it out loud. And then I can prompt that panelist to answer. We have a few questions that have come in already. So we'll start with these, but please keep the questions coming. So our first question is from Kimberly Libman from ChangeLab Solutions. And Kimberly asks, what is the role of a local or state public health department in advancing this policy? And maybe I'll ask a couple of our panelists who are from local health departments, Dr. Archer and Jennifer Herriott. Why did you feel the need, and why do you today feel the need to champion this policy?
I'm happy to answer that from, go ahead, Dr. Archer.
No, go ahead.
So Metro Health was actually identified in the ordinance as the city department that would implement. So we weren't particularly involved in the initial petition, but once that petition was developed and we were identified as the department that would implement, then that was one of the reasons we got involved. But the other obvious reason is that from a public health perspective, having paid sick leave makes a lot of sense for our community. And so we were also took a strong role in just educating stakeholders, city council members, and community members about paid sick leave, all those aspects that were covered in these various presentations, so that they could understand the benefits of it.
So in Kansas City, our health department and our health commission adopted the chief health strategist and catalyst role back in 2014. And that entails us understanding everything in our community that impacts health, and that we need to be bringing those issues up as they move forward. I mean, clearly we got woke when we were having the issue of trying to stop a measles outbreak because folks were being potentially evicted that needed to be in isolation and or quarantine. But beyond that, we know that our purpose in public health is to deal with issues that individuals can't themselves deal with or protect themselves with. We believe in collective action. And so we organize and mobilize based on that. And in fact, I'll probably show this little video, not video, but my backdrop you'll see here. I wear this t-shirt at times, which is our role is to organize the folks that are being taken advantage of by the big fish. And that's our mission as a health department.
Okay, great. Thank you for those thoughtful answers. I want to go on to our next question, which is about dealing with folks on both sides of the aisle on this, so to speak. Mary Quinlan from Western Springs asks, please address effective messaging with conservative elected officials and voters. And this one, I think it would be great for Michael, who fielded our poll, to start off on answering this question, considering Republicans were included in that poll.
Yeah, so to underscore the, one of the takeaways that hopefully came through in the slide deck presentation, the breakout by party ID, I think there was a 20 percentage point distinction between Republicans and Democrats as far as the respondents' party affiliation, but just the Republicans were, at 68% support versus I think it was 15% opposition. So, very, very strong and overwhelming support for this. A few caveats, obviously, are in order. We didn't, do a battery where we tested, two types of arguments against each other in the way that you might sometimes see. So, acknowledging that those numbers are not accounting for some of the opposition's potential messaging. But nonetheless, I think that it underscores at the current moment, there's incredibly strong support even among Republicans. Additionally, I just make that point that we're in, I don't know, right now how others are kind of anecdotally experiencing some of the, the response from conservatives and from others who might have been opposed in the past. But I think given that we are in, for obvious reasons, fairly uncharted waters, I think that, obviously public opinion may be measuring that. And this, this survey that we fielded was right in the heart, April of this year. So it's very much, I think, reflective of people's obvious concerns right now. And, it'd be interesting to, compare this over time when hopefully we are, on the other side of this. But that's, again, I don't want to offer too much conjecture. Just this is the what the survey found. So definitely defer to others with more direct experience in the field and engaging with, some of the audiences that might have been skeptical of this in the past, as far as, if anything has changed in the current moment.
Language matters, and for some groups, more conservative groups often, little things like paid sick leave versus earned sick leave. If people earned it, that's sometimes more supportive. So sometimes I think we do have to be careful, and it would have been interesting if the polling had actually looked at earned sick leave. It might have even scored higher across the board. Another thing that we message is, you need to know where that person may be putting themselves at risk. If they're going out and eating at restaurants where somebody could give them hepatitis A because there's not paid sick leave, or that their kids at childcare, or so it's customizing it, knowing the individually elected official and what their motivations are. It's also then going to groups that influence them and seeing if you can get them to do something along this issue, even just neutralizing, or as we mentioned, getting certain groups like the chamber to maybe decide to stay silent on an issue, so that you can carry the way.
I would just ditto both what Dr. Archer said and what Michael said. We did have to work very specifically with several of our council members who were initially opposed to it. We didn't end up getting a consensus across the board, but we did identify community stakeholders and business owners that worked with us and supported us, and met with those council members to provide guidance and encourage them to consider voting in favor.
Yeah, and we have found in areas where there is the initiative petition process, sometimes the council knows what should be happening, but doesn't want to take on that 1% of very adamant folks and or certain donors that may fund somebody else in the next campaign. So they actually are not always upset about the voters and community organizers initiating a petition drive and taking it to the general population, and then they can be silent on the issue and not have to risk anything.
Okay, great. Thank you for those thoughtful replies. We have two questions that are pretty similar next up, so I'm gonna read them both out. One is from Bernadette Nunley from Multnomah County. She's a policy and law analyst, and the other is from Wendy McClevey at the New York City Department of Health and Mental Hygiene. Both of them ask about how employers can pay for earned sick leave. And if that was an obvious concern in the policymaking process in San Antonio. Wendy McClevey also asks about whether there is talk of promoting federal tax credits for certain small businesses. So if maybe Jennifer could start off answering that question and just speak to how the argument was made for earned sick leave with employers concerned about their bottom line.
Yeah, we definitely needed to help them understand that having paid sick leave would result in less turnover, improved employee morale. We also learned that many individuals don't actually use all of their paid sick leave, even if it's afforded to them. And many of the employers, obviously not all of them, but there were actually a number of employers who didn't realize that they were already offering, because they offer paid time off, that as long as they made a few tweaks to their policy, that it would actually meet the requirements of the paid sick leave policy. And so they realized that that wasn't going to be such a big hurdle to overcome, that it wasn't an additional necessarily, in our case, 56 hours, but rather that some of the paid sick leave they were already offering would meet that requirement. But some employers obviously were concerned that they would have to lay off employees or increase the cost of the goods that they were selling. And so, we share the research with them. There's quite a bit of research that shows that it doesn't actually result in people having to close businesses and things like that. But that was definitely a concern.
Yeah, I mean, if you do the math, it's a 2 if it's a 1 week, or it's a 4%, just under 4% increased cost, compared to all the other potential morale benefits and not having other employees get sick because somebody comes in sick and then spreads it or that. So it's not as huge a piece as people might think.
Okay, I believe that answers all the questions we've received so far. I will give folks just another minute to ask questions. But I think we'll ask Katrina, my colleague Katrina, just for a moment to kind of talk through what she is seeing both in our most recent report here at CityHealth on the earned sick leave front, and whether she wants to touch on any trends that she has noticed as COVID-19 has taken such a big presence in the public health issues in this country. So Katrina, do you have any words for us about trends that you're seeing on earned sick leave?
Sure. Yeah. So I think the polling work that NP Strategy Group and what Michael has spoken to is spot on. I do think we've seen a seismic shift in how the public views earned sick leave because of COVID-19. And that provides a unique opportunity to work with city leaders that maybe, because they were concerned about business attitudes or myriad other factors, may not have been as interested in pursuing this policy. And now we have this really rich opportunity to do so. To the question about the business interest, one thing that I will say, and I think Dr. Herriott raised this as well, it's super important at the start of the process to engage all sides early and often to make sure that you are taking their perspectives into consideration. One of the things that we have seen in the federal bill, which, as I noted at the outset, it's a great first step, it doesn't go far enough, but there was an exemption for employers with less than 50 employees that they would not have to provide sick leave if the justification for doing so would jeopardize the viability of the business. Sometimes you have to make those calculations and considerations when you are working with unique constituencies and working to draft this particular policy. But I'd say the biggest thing that I'm seeing is a shift in attitudes and a willingness for cities to now lead on this and move forward with adopting really strong policies.
Yeah, I'd like to follow up with that. This is a strategic issue that every time we have an outbreak because somebody went to work with COVID-19, whether they knew they had it in particular, we just had a case in Missouri with over 500 people exposed to somebody working in a haircutting salon, and that they were working because they didn't get paid sick leave and they needed the money, and so they exposed over 500 folks. So I think the more we start talking about these issues when these lack of policies have risk and implications to the public, the more we can build on this.
Okay, great. I want to thank all of our speakers who made themselves available today to try to just give us some insight on lessons learned on earned sick leave in each one of their jurisdictions. We thank you so much for joining us, participants, and for your thoughtful questions. We are here to be a resource for you at CityHealth, and we hope that you will visit cityhealth.org to see where your city lands on our 40 city meddling assessment on earned sick leave and for our other 9 evidence-based policies. We really want to keep up the dialogue with you, be a resource for you, and offer technical assistance if you would like to take action on earned sick leave. So thank you so much for joining us today, and please be on the lookout for an email with resources and documents, as well as the slides after this webinar takes place, and then for more webinars in our Come Back Better webinar series, where we invite experts to come and talk about their experiences. So thank you, stay safe, be well, and we'll see you next time.